National Institute of Mental Health and Neurosciences. An institute of national importance is a world renowned center for clinical care, training, research, and policy making in mental health, neurological, and neurosurgical care, making it a premier institute. NIMHANS witnesses a huge footfall of patients on a day to day basis in the Department of Neurology, wherein a majority of them are diagnosed with multiple sclerosis. Multiple sclerosis is a public health crisis that requires collaboration with health experts from various disciplines to address the diverse range of issues that affect not only people with multiple sclerosis but also caregivers and the general public. Our country is experiencing a gradual rise in cases of multiple sclerosis over the past few years, with about 1 lakh people currently living with this condition.
This is an awareness video in view of the World Multiple Sclerosis Day from the NIMHANS Multiple Sclerosis team.
The MS team of NIMHANS on this eve of World MS Day 2024 with the theme of Diagnosis of MS and Navigating MS Together. So here we have brought the multidisciplinary team which is functional at NIMHANS in the care of people with multiple sclerosis. Multiple sclerosis, in short MS, it's an immune-mediated disorder. So what do we mean by immune-mediated? It's basically whenever we have any infection in our body, we have an immune system which tries to get rid of that infection. But this immunity can sometimes be dysregulated, and that could be because of some infection or environmental exposure, and that leads to a neurological condition called as MS, multiple sclerosis. So if we actually look as to what is the extent of this problem in India, there are many studies which show different incidences. Some are as low as 1 per lakh and some show also as 8 to 9 per lakh population, and this depends on the region and geographical distribution. So it is not that MS can develop in any people. This is not a genetically mediated condition, but it affects those people who have some underlying genetic susceptibility, and hence their immune system becomes dysfunctional.
Diagnosis of multiple sclerosis is based on patients' clinical symptoms and signs. When these patients present with various neurological complaints, they are evaluated by a neurologist and with the clinical examination findings often make a possible diagnosis of multiple sclerosis. This diagnosis is corroborated with investigations like blood test, brain scan, and cerebrospinal fluid analysis, which is the fluid which is present around the brain and the spinal cord. During this evaluation, neurologist often makes an attempt to rule out other mimickers which can present like multiple sclerosis.
Clinical feature of multiple sclerosis may vary greatly from person to person and over the course of the disease depending upon the location of nerve fiber affected. The common symptoms are tingling sensation, numbness, slurring of speech, imbalance while walking, difficulty in walking, partial or complete loss of vision, double vision, or loss of control of bowel and bladder movement. MS is also known for its invisible symptom in the form of fatigue, memory, mood and behavior disturbances.
MRI is an important diagnostic tool which helps us to see which parts of the brain and spinal cord are affected in multiple sclerosis. It not only helps us to make a diagnosis, it is also useful to differentiate conditions which mimic multiple sclerosis, and once the diagnosis is made, it also helps us to assess the treatment response.
In the management of multiple sclerosis, I want to emphasize two things. One is when you're made a diagnosis of multiple sclerosis, it requires longer period of treatment. What happens is there is a discrepancy between what you are having and what the investigations are showing. For example, when you develop symptoms of multiple sclerosis, usually sometimes it remits by itself, or some people receive a short course of corticosteroids by which their symptoms improve. So you will see that you have completely improved, but you've been made a diagnosis of multiple sclerosis and been asked to take the treatment for a longer period of time. That is because this disease goes on relentlessly underlying in your body without your knowledge, and that's the reason you require a long-term treatment. So when you're diagnosed with multiple sclerosis, there are two types of treatment. One is the symptom reduction in the immediate time when a relapse or an attack happens. That is treated with corticosteroids, but eventually the goal is to prevent further relapses or further attacks, and for that you need to be on long-term disease modifying agent. So please always be in consult with your neurologist and take the appropriate medication under their guidance. Thank you.
The multiple sclerosis team at NIMHANS brings together health experts from different departments, with each specialist bringing their own expertise and experiences.
Receiving the diagnosis of MS can be very stressful for individuals, and it may take a toll on their mental health. The most common mental health problems that we see among individuals with multiple sclerosis are anxiety and depression. When these conditions coexist with multiple sclerosis, it can affect the individual significantly. So it's important that we address mental health problems at the earliest.
So as we know, multiple sclerosis has so many dimensions to it, and one of the important thing is neurocognitive deficits. You may observe symptoms like slowness in thinking, or slowness in doing something, or inability to remember things, which we call as impairment in neurocognitive functions, which requires a detailed and a thorough evaluation. Subjectively you may feel it, sometimes objectively we may not observe, or vice versa. But in any case, a detailed neuropsychological evaluation would be an important part of the treatment program of multiple sclerosis condition. It also includes a detailed understanding of psychological sequelae of this condition, and as neuropsychologists we offer not only neuropsychological rehabilitation but also psychological support to these patients.
Having MS in your life can be challenging, whether it is you who are diagnosed, a family member, or a friend. Adapting to the diagnosis of MS, uncertainties regarding the future, and how it can impact your life in general are some of the challenges encountered. Symptoms such as difficulties with sleep, pain, and fatigue further contribute to poorer psychological well-being, the experience of anxiety and depression, and in turn, these impact quality of life. Clinical psychologists can help you, your family, and significant others understand the challenges of MS and help you in making choices about how to deal with MS and how it impacts your life. Evidence-based psychological therapies are an important part of the management of MS. Amongst these, cognitive behavior therapies have been found to be most effective in dealing with the symptoms of MS, such as depression, anxiety, sleep, and fatigue. Psychological therapies work by strengthening coping skills, targeting unhelpful thought patterns, and in developing acceptance and the ability to deal with uncertainties, thereby improving quality of life.
A diagnosis of multiple sclerosis can have a significant impact not just on the neurological and physical dimensions as we have been listening. It also has psychological changes. It can also affect a lot of social relationships that we are all part of. As we all know, no man is an island. We live in society. We live in relationship with other people around us. So it could be our family, it could be our friends, it could be the workplace, colleagues, it could be the larger society also. So when we are going through or managing an illness like multiple sclerosis, the reciprocal relationship of what we do on other people and what other people do on us has to be acknowledged. And whenever we feel there is a help required, don't feel hesitant to reach out. So when we feel there is a problem with the relationship, let us seek help. There is a team that is ready to help you. We can work with interpersonal relationships, we can work with coping, adaptive management strategies that will help us to seek better social support, which will in turn help us manage the disease better and lead a better quality of life.
Along with the medications, neurorehabilitation services become very essential. Dr. Anupam Gupta, professor at the Department of Neurological Rehabilitation, adopts the current best practices adhering to globally recognized standards of care. The services are tailored to deal with neurological and urological problems.
Hello. Multiple sclerosis is a multifaceted condition which presents with a range of neurological and psychiatric symptoms. And given this reality, it's only understandable that the treatment for this condition also has to be multidisciplinary. In this era, integrative medicine plays a very important role in handling the symptoms and giving relief to patients with multiple sclerosis. Let us all encourage evidence-based integrative medicine as a part of treatment in multiple sclerosis.
Both World MS Day and International Day of Yoga are celebrated in June. Current evidence shows that yoga can be a very useful add-on in the management of MS. Yoga can enhance quality of life, reduce fatigue, improve exercise capacity, cognition, and quality of sleep in MS. Under the leadership of Dr. Netravati, we are exploring this through a randomized controlled trial funded by DST Satyam. Thank you.
Multiple sclerosis belongs to an overarching term Vatavyadhi in Ayurveda. It's a part of descriptions that have been described in Ayurveda under the theme of Vatavyadhi. The treatment of multiple sclerosis according to Ayurveda includes Panchakarma therapies as well as diet, lifestyle, and also oral herbs which are given as medicines. The treatment involves application of oil over the body and also use of therapeutic enema. Apart from that, it is the diet which is very specific for diseases. Ayurveda prescribes specific diet for specific diseases, and in Vatavyadhi specific diet is advocated, and apart from that specific lifestyle is also advised.
Multiple sclerosis nursing consideration needs a skillful management of a nurse. Especially the patient comes with so many problems deteriorating day by day. They need a psychological and emotional support. That is our first priority. Assisting self-care, educate the patient to avoid complications and perform the skin care, especially head to toe. Also minimize the contractures, especially the joint contractures. Stretching exercise are taught. Avoid pressure and immobility of the joints. Also, we teach the patient how to do the self-catheterization and bowel care. Also, how to use the walking aids or the wheelchair and how to prevent the urinary tract infection. We administer the medication as per the doctor's advice when and where it is required. Also, we teach them the health screening, the regular follow-up, and how to follow the medications. And we plan discharge. Also, always with the patient, there should be an open dialogue. It should not be a closed dialogue. Patients should know every day, day to day, what is happening to them, involve them in the planning along with the family. The family support is very much is required here. Also, from where they get the finance, the self-help group or other group who can help them. Also, introduce the other therapies, what they require, whether it is a speech or it is a physiotherapy or it is a cognitive thing and many other thing which is available in NIMHANS, we introduce the patient to that. And also a special message from the nurses, I wanted to tell, we care you. Very much we care about you. We would really like to help you in the best possible way we can.
Today I'm here to speak about something very important, the importance of education towards those suffering from multiple sclerosis. Multiple sclerosis, as we all know, isn't just a physical ailment. It impacts lives in profound ways, often unseen by others. That is why educating ourselves and our communities about this illness is very crucial. Think about it. When we know what to look for, we can catch symptoms early, ensuring timely care and better outcomes. And when family and friends are informed, they become pillars of support, offering comfort and strength in tough times. But with the right actions like prompt treatment, stress management techniques, and seeking help when needed, we can find emotional balance and navigate effectively. And let's not forget the power of awareness. By spreading knowledge and compassion, we create communities where everyone affected by multiple sclerosis feels seen, heard, and supported.
Persons living with multiple sclerosis face challenges because of their complex medical social needs. They can have problems with movement, with their cognition, behavior, and in their work as well. The neurologist plays a very crucial role in early diagnosis and management of people living with MS. Here at NIMHANS, at the Department of Neurology, there is a vibrant team of doctors working with the multidisciplinary team, doing their best for people living with multiple sclerosis. There is a multiple sclerosis clinic that is run on every fourth Saturday of a month, where the team dedicates its time and efforts to provide treatment to people living with multiple sclerosis, provide the best possible medical treatment. It can be challenging to choose between the various drugs, and the MS team led by Dr. Nitravati at NIMHANS is doing its very best to provide care for people living with multiple sclerosis.
For treating multiple sclerosis, our hospital offers a multidisciplinary approach aimed at managing the symptoms, slowing the disease progression, and improving the quality of life for patients. With specialists for multiple sclerosis treatment, advanced MRI facilities, and implementing comprehensive and patient-centered approach, our hospital not only provides the treatment effectively to the patients, but also provides high quality of life that addresses the disease needs of the individuals living with condition, including psychiatric, psychological, and social work support.
Multiple Sclerosis Day is observed on the 30th of May every year. Like with all other health days, the MS Day aims to enhance awareness among people about multiple sclerosis and the various disabilities that it leads to. So at NIMHANS, we have a lot of events that are organized every year to mark the World MS Day.
Good morning. Every year, Multiple Sclerosis Day is being celebrated on 30th May. This was initiated in 2009 by Multiple Sclerosis Global Foundation. The aim of each year is to bring out a theme which addresses the various aspects and the issues faced by the patients with multiple sclerosis. This year, the foundation has come out with a theme, My Multiple Sclerosis Diagnosis, with a tagline, Navigating MS Together. The aim of current year's theme is to make early and accurate diagnosis of multiple sclerosis.
The World MS Day is celebrated to bring an awareness among the common public related to the multiple sclerosis, a neurological disorder, to have a greater understanding about the disease and the management, and also to be aware that the technology has grown and the facilities are available to treat the MS patients. And NIMHANS has evolved over a period of time, new treatment regimes, and a comprehensive treatment is provided for the MS patients, and by using various treatment modalities with the involvement of the various other divisions within the NIMHANS. It's not only by the neurologists, the physiotherapists, nursing care, and integrative medicine, and multiple approaches has been used to take care of the MS patients at NIMHANS. This comprehensive approach, which we are doing at NIMHANS, that has become a model to the remaining parts of the country and to the rest of the world as well for the management of MS patients. So the kind of research and the scientific evidence which is evolved by using the cutting edge technology to understand the MS is always helpful, and most importantly, the patient-centric treatment regimes has evolved over a period of time. I am very sure that the MS Day, which we are celebrating at NIMHANS, is to bring an awareness among the common public and among the professionals, and to evolve new strategies for treating the MS patients.
Multiple sclerosis is a neuroinflammatory disease, and it causes a wide variety of neurological symptoms. It's very important that it's diagnosed early and that these symptoms are treated. Every year on 30th May, we observe Multiple Sclerosis Day to bring attention to this debilitating disorder. This is celebrated by organizations around the world, and at NIMHANS too, we observe this day. At NIMHANS, we have the largest registry for multiple sclerosis in the country. We also offer fellowship courses in multiple sclerosis. We have a multidisciplinary team that addresses the various treatment options, investigations, and long-term management of this debilitating disorder. As we come together to observe Multiple Sclerosis Day, we'd like to bring together all stakeholders, patients suffering from multiple sclerosis, their family members, healthcare providers from various disciplines to come together to observe this day and to see how we can make the lives of persons with multiple sclerosis better. Thank you.